Hello, my name is Martin Lipscomb, and in this conversation I'm joined by Professor Anne Gallagher, ex of the Open University, Kingston University and St George's Hospital Medical School, where I also once worked. Anne is now at the University of Surrey, England. There she is Professor of Ethics and Care and Director of the International Care Ethics Observatory. Anne is a Fulbright Scholar, and she is also Editor-in-Chief of Nursing Ethics. And if that wasn't enough, Anne is a Fellow of the Royal College of Nursing and a Fellow of the Royal College of Surgeons of Ireland, so no slouch then. Anne's interests lie in applied and practical ethics, both philosophical and empirical, and working with others at an international level. She's produced more than 50 peer-reviewed papers and 6 books, and her latest book, Slow Ethics and the Art of Care, forms the subject of this conversation. Slow Ethics isn't an introduction, nor is it a straightforward exposition. Instead, in this very personal work, Anne presents readers with stories, and from these, readers are invited to reflect upon and draw their own conclusions from the tales which are described. To quote, "Slow ethics is an approach which that is applicable within and beyond formal caregiving contexts. I hope that readers will benefit from reading stories which aim to show, not tell. This book provides then a bricolage of stories and insights of the best caregiving, illuminated by slow ethics." Anne, it's great to speak with you. It's great to have you here. Please, can you tell us something about slow ethics? What is it that you're trying to achieve in this book? And also, how might the ideas that you're interested in inform thinking around research?
Great. Good morning, Martin. It's great to speak to you. So the idea from slow ethics, as I detail in the book, I had an epiphany around 2013, just after the Francis report was published. I was in Stockholm taking a rare mini break and went to an exhibition on slow art. And when I read the information at the exhibition, it was about quality over quantity, taking time to do things well, sustainability, and so on. I just thought, whoa, this resonates so much with the discussions in the UK at the time. And there was what I would describe as moral panic. I mean, it was a terrible situation, and there was much suffering on the part of patients and families. But I was struck by the responses, particularly of our leaders in healthcare. And it seemed to me they wanted quick responses, knee-jerk reactions, as I said, panic. And I thought, I'm not sure that's the way we should go about our ethics in health and social care. It takes time to do things well. It is quality over quantity. It is about sustainability. So that was the spark. And then I was lucky enough to have a 9-month sabbatical just over 2 years ago. And I spent time in Tuskegee, which is a very well-known university in Alabama, and of course with a very strong history in relation to research ethics. And that was very inspiring. So when I was there, I thought more about slow ethics, and then arrived at some other S's, I suppose, the central concepts of the book. So the idea of stories being very central, the idea of ethical sensitivity being critical to care, and of course also to research practice, the idea of having space, and I'm mainly interested in moral reflective space for people to think and to think well. Scholarship. And it also struck me at the time of the Francis reports that people were very forgetful. They didn't take the time to look at what had gone before, particularly the good work in nursing ethics, and to build on that. For example, the 6 C's is an example of a lack of attention to what had gone before. And also the idea of solidarity, increasingly, and in this moment during the pandemic, of course, and with Black Lives Matter, I'm just so struck by the importance of the concept of solidarity. We are all human. We are all, we have frailty, we have vulnerability, and we also are in a position to experience great joy. So that was the background to the book. And I think in terms of research for nursing, I would like to think it has much to offer in helping students, and indeed remind ourselves that the endeavour we're engaging on to improve patient care, to improve the care of care recipients across health and social care, it's not a quick endeavour. It takes time, it takes thought, it takes reflection.
Okay. Let me ask you some questions about the book, or rather about ethics and moral teaching in general and come back to the book. Um, Outside of specialist modules and courses, ethics and ethical thinking is introduced to students often through the prism of principalism, or perhaps more rarely, nurses will be introduced in broad brush terms to virtue ethics, utilitarianism, deontology. Now, your book explores bottom up, a very different view or perspective on ethical thought than that captured by the top-down meta-theories that I've just mentioned. So from this, should we presume that you think these overarching theories are on their own inadequate or in some sense lacking when it comes to what's needed in healthcare?
Yes, I suppose in short, I would say it's not either or. We need attention to the particularities of research practice. We need attention to the detail. Critically, we need attention to the experience of research participants, to put ourselves in their shoes, to think about their experience. And as I said, I had the privilege of spending time at Tuskegee at their National Research Centre, and many of your students will know about the Public Health Department syphilis trial. And listening to those stories are incredibly powerful. And we need to remind ourselves of what has gone before. We need to listen to the stories of being on the receiving end of both ethical research and unethical research. But I would want to emphasize the importance of critical reflection. And to reflect critically, we need something to think with. We need concepts, we need theories, we need philosophies. You cannot think without language. So the principles do have a role. It is very useful, and you might say that informed consent is the cornerstone of ethical research practice, which relates to the principle of respect for autonomy. We need to weigh our benefits and harms, beneficence, non-maleficence. We need to have research that is fair and just. But that's not enough. In addition to attending to the stories, the particularities the research participants experience, we need to think about ourselves and who we are and what our virtues indeed are. So we need to think about our motivation to do research. Now, I know some universities have values such as ambition and excellence in terms of scientific excellence, and that's fine. But again, we need to think a bit more about justice and compassion and kindness and integrity. So critically in our research, the idea of honesty and integrity are central. And I'm sure with your students, you will direct them to websites, Retraction Watch, and so on. We know there continues to be a great deal of unethical practice in research. And sometimes it is because it seems people feel under great pressure and they cut corners. And I think if there's anything I would want our students, all of our students in health and social care, to know is that sometimes they will have to take a stand. So moral courage is also a critical virtue whenever things are not as they should be. And if our students feel that the rights and interests of research participants, and indeed themselves also, because they're also vulnerable, junior researchers are also vulnerable, that sometimes they will need to take a stand. So I think in our teaching, we do our students an injustice if we don't help them to know which processes they need to go through, indeed, if they have concerns. And I suppose critically, I always want to tell our students that, they're not alone. There are people in trustworthy colleagues in senior positions who will be able to support them should they uncover some practice that is not ethical.
And by structuring your book through the presentation of stories, are you imagining that these stories can sensitize and alert readers to ways of thinking about ethics which might not be so obvious if one just stays with the top-down theories?
Yes, and I suppose, I say at the beginning, I think you quoted this about, the story show, not tell. So for example, I think one of for me, the most powerful examples in terms of research ethics is the example of the nurse in the syphilis trial at Tuskegee. And to begin with, it seemed fairly straightforward. You think, how could a nurse, someone who belonged to our profession, collude with such an unethical research study, let's call it that. where informed consent was not given. The men were not told the truth about the nature. They were not told they had syphilis. They were not told that they could have treatment. So it was very easy initially to blame that nurse. And then when you listen to her story, and a lot has been written about the nurse involved in the Tuskegee study, you begin to unravel the complexity about why people do or don't do the wrong thing. So I think stories absolutely sensitize you to the complexity of the moral life and the ambiguity. And as I said, we're very sort of quick to judge. And I suppose if there's anything to be taken from this, is ask more, listen carefully, judge slowly. And hopefully that will help us to develop our own moral resilience, so that should we find ourselves in positions where we might be compromised, we will be much more alert to that situation and then be able to take a stand and hopefully resist.
Okay. What should researchers consider when they're planning and conducting studies? And here I'm not just thinking about ethics approval, institutional sign-off on planned work. Reducing ethics or research ethics to ethics approval in this fashion is a desperately limited way of thinking about ethics. Rather, I'm interested or thinking about the ways in which ethical ideas and the normative mores that they inform or reflect steer the research process more generally. And I think this ties back to what you were saying just now about the nurse. Do you have a view here? Might the ethical ideas that we hold lead to certain forms or areas of study being promoted, other areas being downplayed? And are researchers and research consumers always aware of this?
Yes, I think we need to, with your starting point in this question, we need to move beyond checklists. And sadly, I come across this sometimes when I'm invited to give a lecture on research ethics. Sometimes students are very driven by assessment, say, and driven by the bureaucracy of ethical review. Now, there's a place for some of that, but I think the critical thing is to move beyond the checklist and think more deeply and broadly about the nature of research in relation to health and social care. And to do that, yes, of course, it's very important to know about the principles and to reflect on our virtues, but it's very helpful also to reflect on history. So it is an interdisciplinary endeavor to be serious about research. And I suppose critically, our students and indeed ourselves, we need to ask, why are we doing this research? Is it meaningful? Does it have a purpose? So I think, yeah, it's not, definitely guard against a checklist approach to research ethics, guard against a focus purely on the bureaucracy of ethical review, and think more broadly and deeply about why we're doing research, what is our intention, what is our aim. And there's no one paradigm. I mean, I think one of the joys of nursing research in particular is we clearly engage quite easily and freely with different paradigms, the positivist, naturalistic, mixed methods. And that's really great, because we do take the experience of whole humans seriously, as well as clearly want to find answers, solutions to some of our biggest scientific challenges of the time. And of course, at the moment, there's a lot of activity in relation to pandemic ethics, and nurses have so much to contribute to that.
And that was really interesting. Lots of food for thought. I can heartily recommend your book, and thank you for joining me here today. Obviously, there are lots of more things we could talk about, but I thought that was really interesting. So thank you.
Thank you, Martin. Lovely to talk to you.